We're back in New at 4. Time to talk about keeping your kids' teeth and more in good shape. This is National Children's Dental Health Month. It's a good reminder for parents. So here with that, Danny Ford, the manager of school-based oral health programs at Denver Health. Danny, thanks so much for coming in and talking about this. I appreciate it.
No problem.
You talk about oral health issues that you see in a lot of kids. You work with a lot of them at different schools in the area. What issues do you see the most?
Cavities. Cavities is the most prevalent chronic disease faced by children and adults. In children, though, it can manifest as low levels of pain or high levels of pain. And that can result in inability to focus at school, missed school, and in some cases, cavities can become life-threatening.
Man, that's a big issue. And obviously it affects their education and learning and all of that. I think goes without saying, probably brushing, flossing, having good oral hygiene, the easiest way to combat those.
Yes.
A lot of parents might ask, I can't get my kids to brush and floss all the time. What do you tell them?
Make it a family affair. Kids tend to mimic the adults in their lives as far as habits, good or bad. So if it's a family affair where whoever the grown-up is that's taking care of that child and putting them to bed says, let's brush and floss our teeth together, they're more likely to want to do that with them and think it's a fun thing that they get to do with the grown-up. They also need to make sure that they're helping kids brush their teeth until around 8 years old or until they can tie their shoes by themselves.
Okay, good advice right there. And I think there are different flavored toothpaste and all that that work
make
kind
it
of
fun.
Make it fun, make them interested, make them want to do it.
Yes.
You talk a lot about sealants and how they're important for kids, and you do a lot of work with that in Denver Health and some of the clinics. Why is that?
Because it's important. It's an evidence-based practice. Sealants are a protective coating that go over the back teeth, and they are about 80% effective at preventing cavities from happening. They're quick, they're painless, and a lot of programs do them right in kids' schools, so adults don't even have to take children into an office to get it done.
All right, and there are programs available that do that at no cost to the people, because I know some people may be wondering, I don't have great dental insurance, or I'm just concerned about the extra cost with this.
Yep, there's lots of programs that do that at no cost to those families.
And real quickly, I know you want to talk about baby teeth. How important are they?
Baby teeth are very important. They're the placeholders for the grown-up teeth. They're responsible for children learning how to eat and talk and their jaw to develop. So the longer they're in there naturally, the better off children are.
Okay, Danny Ford with Denver Health. Great advice today. Appreciate it.
No problem.